Hi, my name is Dr. Lenore Sikorski, and I'm the medical director of Natural Image. We have a new technology here called CoolSculpting, and we're very excited about it. We, for many years, have done liposuction on patients, but we're finding that our patients, a lot of them also want non-surgical treatments. And Zeltica is just part of that armamentarium of things that you can do that have no downtime, very little risk, and are non-surgical.
What I found most appealing about the CoolSculpting treatment was that I could get rid of some of this lower belly fat and this stubborn muffin top that's just been driving me crazy without any real downtime. I can even do a treatment on my lunch break and go back to work. I'm a working mother, I go to school, and I've thought about liposuction before, but I can't risk the downtime.
Sandy is a perfect candidate. She's, a mom who has a little bit of a pooch or a bulge, and very discreet. What we have to do when we start the procedure with the CoolSculpting is we have to put a thin membrane on the skin, and that actually protects the skin from the cold. And that's one of the reasons that there's no damage to the upper layers of the skin, because what we're doing is we're bypassing those upper layers and getting to the fat layer that's deeper. So that membrane is put on, it's smoothed, and then the applicator is put on. What the applicator does is it has a vacuum which takes the fat and puts it into the little applicator where the two little cold panels are, and the cold panels essentially cool the fat to almost a freezing point. It feels like ice cubes on the skin. And so we found out that fat, when you do that, will actually sort of explode in a way. They have apoptosis. They just, all of a sudden, they start to go away. They lose their contents and inflammation occurs. But the neat thing, like I was saying, is that there's no scarring or any sort of surgical remnants, because it's not surgery, it's non-surgical. And so it's something you can do in your lunch hour. It could take an hour to 2 hours depending on how many areas that you end up doing. But Sandy right now is basically having the fat, and for 60 minutes that fat will be frozen, and at the end of the treatment we'll take off the applicator and she'll be a little bit pink, and what we'll do is we'll massage that area, because we have found, and you'll see how we massage it, it's sort of like kneading bread, and then we do this wax on, wax off for about 2 minutes, and we found that that actually increases the effect of the treatment. So initially, researchers are thinking that the treatment was about 20% fat reduction, maybe even 25%, but it can be up to 40% improvement in that area by doing this 2-minute massage. So we have incorporated that in a procedure, and we have found that it really does, in fact, improve our results. The company has come out with new applicators so that we can do more areas. You can do the stomach, you can do the love handles, you can do this area underneath your arms. There's so many great applications for this technology. It's so much fun, and it's perfect for the patient that just does not want to even think about surgery, does not want to think about losing any time.